hearing amplification and or bilateral blindness. Here are our patients. We searched our database for all IUTs performed between 1997 and 2009 for cases of parvo B19 infection. 45 IUTs were performed in 44 fetuses to correct anemia in hydrops. And here's a flow chart. Of these 44 fetuses, 32 survived. We had a survival rate of 73%, and 3 cases were lost to follow-up because of loss of contact address. And we had to exclude 1 case because of a rare syndrome named Buske-Ollendorff, which is known to be associated with permanent handicaps. And in total, we included 28 children for follow-up. Our methods. Our follow-up consisted of an assessment of neurologic functioning and a developmental test in children at least 1.5 years of age. And as you can see from our baseline characteristics, all children were diagnosed with hydrops. Mean gestational age at IUT was 22 weeks, and mean gestational age at birth was 39 weeks, and the majority of the children was male. Our results. The mean age of the children at follow-up was 6 years, and 1 child was diagnosed with both cerebral palsy and developmental delay. 2 other children had developmental delay only, severe developmental delay. There were no cases of bilateral blindness or deafness. Minor neurologic dysfunction was found in 3 children and mild development delay in 2. So in total, our incidence of NDI was 11%. And then we go to our conclusions. When we take a look at the literature, there's not much published to date. There are only 2 small follow-up studies that focused on the neurodevelopmental outcome of parvo-induced hydrops. 1 from Germany and 1 from our own group approximately 5 years ago. Dembinski and colleagues reported normal neurodevelopment in all their 20 survivors. However, they had a high loss to follow-up rate of 35%. And according to the literature, the chances for adverse outcome are generally higher in the group that's initially lost to follow-up. Nagel and colleagues reported 12% of NDI, but however, their group had a lot of children who were younger than 8 months at follow-up, 4 children, which is too early for an accurate assessment of cerebral palsy or severe developmental delay. Well, because there's not much to compare it with in the literature today, we looked at a subgroup of children with an almost similar history, that is hydrops due to Rhesus disease. We recently followed up this subgroup with the same methodology, and the rate of NDI in this group treated with IUT for Rhesus-induced hydrop is 12%, and this is quite similar to the incidence we found in our group of children with IUT for parvo-induced hydrops. And because we did not include any controls, we compared our rate with the general Dutch population. In the general Dutch population, the rate of CP is 0.2% and the rate of severe developmental delay is 2.15. So children after IUT for parvo-induced hydrops seem at a higher risk for long-term impairment. The exact cause or risk factors for long-term impairment, however, we don't know. To investigate risk factors, we need a much larger sample size. We have insufficient power with this group to examine these risk factors, and therefore larger multi-center follow-up studies are needed, including an international registry. Thank you.